Hi, I'm Grace. So I recently gave birth to a boy at Pantai Hospital KL via Waterbirth. I started birthing actively in the tub at around 9 p.m. and baby came out around 12 midnight. Definitely the Waterbirth helped because I could squat. So when you totally can open up your hips. I think it's very hard to squat when you're full-term pregnant without water, honestly. But to squat in a full tub of water, that's very possible because you're fully supported. I don't have to worry that I'm going to fall down or what. So yeah, I could squat, I could kind of be on all fours and the baby could come down very easily. The nurse was wonderful. So when I was in the tub, the nurse actually pours water over you like for the whole duration of labor, which really helps. I didn't realize how much it would help actually, but it really helped to feel the water going over my shoulders and just soothing the pain. Yeah, so that was really good. And then Dr. Paul, he came in to deliver the baby. I think the water birth basically allows you to be supported by the water. So that gives you the ability to move your body the way that you want to. And that helps in the birth to, as your body goes through contractions for birth, you can work together with your body and not be passively lying down, which often happens in a natural birth. Of course, even though you're lying down, yeah, you're pushing, but it's not really the easiest way to remain not moving versus in a water birth situation where you're in the tub, you're supported, you can go into any position that you want to allow the baby to descend and to birth. Dr. Paul, as always, is very calm, very measured, and given that I did my previous unmedicated natural birth with him, so when I told him I wanted to try water birth and my pregnancy was without complications, so yeah, he was very supportive and there was no issues, I think. If you want a natural and unmedicated birth, then yes, please consider water birth. But you need to answer the question first, do you want a natural unmedicated birth? Because I think that's the premise before you go into whether you want a water birth or just a dry birth. In my second birth with the water, it was even easier because I could really work with the contractions and the so-called pain, which is actually your body pushing out a baby, was able to progress very quickly. So that's why I think the labor was pretty smooth. It's definitely the greatest privilege, I think, to be able to birth and to be able to birth very consciously so that I can be present in their birth. Both for my older daughter Annabelle and for my younger son David, I could be present with them and I could hold them right after birth, and also I could breastfeed them immediately because the circumstances are such in a natural birth that you are very present, you're very aware, and you're not like sleepy or anything like that. I was out of the hospital kind of on the same day. So I birthed past midnight on the 18th and I checked out by the end of the 18th, even though I think Dr. Paul did say if I wanted to stay another day, it was totally okay, but I was perfectly okay, so I checked out by the end of the 18th. Yeah, I'm very thankful. And it's just a joy to be able to bear life, to be able to birth. It's the greatest privilege.